how you can care for your mouth, in a more effective way. So firstly, the risk factors include, sorry, my clipboard just fell. Okay, risk factors. Okay, so certain medical conditions like your uncontrolled diabetes and your hypertension, right? And then you have familial tendencies, so you have a greater likelihood of having periodontal disease if another family member or family members are suffering from it. Also, poor oral health, you're not brushing and you're not flossing properly. You have things like stress, factors like smoking and drinking as well, right? Pregnancy can worsen any existing gum condition. It doesn't necessarily cause gum conditions, but if you have an issue, it will worsen it, right? All right, so we've covered, and there are also some medications like your calcium channel blockers, like your nifedipine, that also will cause swollen gums, right? So if you have an existing gum issue, of course, that will make it worse. So some of the symptoms you'll experience will depend on whether it's the early stage of the disease, which is gingivitis, right? The gingiva or gums, so gingivitis means the risk factors. So you'll have red swollen gums. It may bleed when you brush. It will bleed when you floss. Okay. If the gums are really, really swollen, then you'll have some discomfort from them. When it progresses to the later stage, which is periodontal disease, then you start to lose support from around the teeth. So the bone will go, the gums will recede quite a bit, and the teeth will look long. People will say, oh, my teeth are growing. Your teeth are not growing. Your gums are actually just receding. Okay, so certain medical conditions, some of the time the teeth may change position. So you'll have drifting of teeth because they're loose as well. And then you have familial tendencies, so you have a greater pain or tenderness when you try to eat your food, right? You may experience sensitivity from all of the teeth. A patient told me, she said, boy, that family member my whole mouth felt like it was hurting. You'll experience something like that as well. Poor oral health, you're not brushing and you're not. Also, for both of them, you can experience halitosis or bad breath. You have things like stress, with periodontitis, and drinking. The patients will tell me, boy, doctor, I'm brushing twice a day and I still have this odor. Also, with periodontitis, you may end up with some blood on the pillow when you wake up in the morning. Right? That's another common symptom. So, untreated, it can lead to you losing your teeth, of course. And it will lead to poor nutrition because you're also more likely to go for soft foods that are not hard to chew, which will mean that they're more than likely going to be processed and unhealthy for you. Calcium channel blockers, it can also lead to diabetes and heart disease. So in terms of the importance of treating it, stabilize the blood pressure, stabilize the blood sugar, right? And in terms of pregnant women, it will decrease your risk of having preterm birth and low birth weight. So that's also very important. So in terms of how we assess you and how we manage it, and you'll have some of course, everything starts with a conversation. So you'll tell me what's bothering you. The later stage, the gums are swollen, they're bleeding, they're tender. I will start to ask you, okay, so how often are you brushing? I'll start to ask about your health. Are you diabetic? You start to lose support. High blood pressure. I'll start to ask, does anybody else in your family have loose teeth, bleeding gums, etc. So we find out more about the habits, right? If you're not brushing at night, which is a common thing, the gums will recede. If you're diabetic and you're not taking your medication properly and it's not properly controlled, that's another common thing. Sorry. I was just watching something blinking. Okay. Oral health. Alright. So then I'll ask about the diet. Whether you're having a lot of soft, sticky foods that will stay on the teeth even after you try to brush. Right? After that, the next thing will be the examination. So we'll be looking for whether the gums are red if they're swollen. What we'll also be looking for are things called pocket. So in a normal healthy person, when we stick a probe by the gums, it will go anywhere between 1 and 3 millimeters. Pregnancy can worsen still have this odor. All right. When you have gum disease, however, the probe will sink further, right? So these pockets will present areas that will trap
of,
plaque even more, right? And once you have the tartar build up there as well, that's a situation that we need to take care of to reduce those pockets and get you back to health. So the pockets, when we measure that, that's a good indication to show you that, hey, our intervention is working. We're not just crazy people, okay? So you can track your progress that way.
And in terms of pregnant women,
another thing we'll be looking at is how far the gums have moved from the teeth, called recession, right? So we'll do all of that to measure the severity of your disease, and we will use your risk factors as well as your age, right? And come up with how severe the disease process is, and based on that, we can determine our intervention. So another thing that's extremely helpful, and no examination really is complete without your diagnostic radiographs or your x-rays, right? The x-rays will help to show us the bone levels and how the bone is shaped, right? So sometimes once we have to bounce it to the specialist, sometimes they may have to reshape the bone in some areas to ensure that you can maintain health in those areas. We'll look and see if there are any teeth, like your wisdom teeth, that you just can't get back there and clean, if those need to be taken out as well, right? Because a lot of people, they have localized areas where they just cannot clean, right? And one of the most common spots is by the wisdom teeth. So after the examination and the x-rays, we'll come up with a plan for you. And that plan will be based on whether you have the initial stage or the gingivitis, or if you have something more severe like periodontal disease, and very, whether it's mild, moderate, or severe. So for gingivitis, you may just need a regular cleaning, right? And we give you some instructions to show you how to floss. We tell you need to be brushing twice a day, right? And then, depending on how severe the gingivitis is, we may bring you back for reassessment, or when you come back for your cleaning, then we'll say, oh, you really measure that. That's a good indication to show you that, hey, our intervention is working. We're not just crazy people. Periodontal disease, however, it may need a combination approach of medications. Not going to go into all of those medications for you to start yourself, but so you can combination approach with medications as well as what people call gum treatment. Another thing we'll be looking at is so we'll do a general debridement, getting off most of the tartar. And then we will have to bring you back and numb the areas for your comfort and really get to measure the severity, clean them out properly for you. And we will, so for people that have gingivitis, if it's not that severe, if we figure, hey, we can brush and floss and get this under control and you're compliant, then you can come back in 6 months. How severe. If, however, you have periodontal disease and we say, okay, you definitely need some more monitoring, or even if you have severe gingivitis, we will recommend that you come back in 3 months' time for us to reassess you. And then if you have pockets that have not resolved, they're extremely deep, they have not resolved, you're trying your best, we see where you're making an effort, then we'll bounce you to the periodontologist, which is the specialist, the gum disease specialist. And they may have to do further intervention, which may involve surgery. Like your wisdom teeth. So the bottom line is, an ounce of prevention is always better. Have a good day, everyone, and stay safe. And get back there and clean if those need to be taken out as well, right? Because a lot of people, they have localized areas where they just regular cleaning. We give you some instructions to show you how to floss. We tell you need to be brushing twice a day, right? And then, depending on how severe the gingivitis is, we may bring you back for reassessment, or when you come back for your cleaning, then we'll say, oh, you really measure that. That's a good indication to show you that, hey, our intervention is working. We're not just crazy people. Periodontal disease, however, it may need a combination approach of medications. Not going to go into all of those medications for you to start yourself, but so you can combination approach with medications as well as what people call gum treatment. Another thing we'll be looking at is, so we'll do a general debridement, getting off most of the tartar, and then we will have to bring you back and numb the areas for your comfort and really get to measure the severity, clean them out properly for you. And we will, so For people that have gingivitis, if it's not that severe, if we figure, hey, you can brush and floss and get this under control and you're compliant, then you can come back and come up with how severe it is. If, however, you have periodontal disease and we say, okay, you definitely need some more monitoring, or even if you have severe gingivitis, we will recommend that you come back in 3 months' time for us to reassess you. And then if you have pockets that have not resolved, stay safe. And get back there and clean if those need to be taken out as well. Right? Because a lot of people, they have localized areas where they just regular cleaning disease. However, it may need a combination approach of medications. Not going to go into all of those medications for it to start. But so you combination approach with medications as well as what called gum treatment. Another thing we'll be looking at is, so we'll do a general debridement, getting off most of the tartar, and just to reassess you. And then if you have pockets that have not resolved, stay safe. And get back there and clean if those need to be taken out as well. Right? Because a lot of people, they have localized may need a combination approach of medications. Not going to go into all of those medications for it to start. So you can combination approach with medications as well as what gum treatment. Another thing we'll be looking at is, so we'll do a general debridement, getting off most of the tartar, and just to reassess you. And then if you have pockets that have not resolved, stay safe. And get back there and clean if those need to be taken out as well. Right? Because a lot of people, they have localized may need a combination approach of medications. Not going to go into all of those medications for it to start. So combination approach with medications and in terms of pre-disposing treatment. Another thing we'll be looking at is, so we'll do a general debridement, getting off most of the tartar, and just to reassess you. And then if you have pockets that have not resolved, stay safe. And get back there and clean if
those need to be taken out as well. And people, they have localized we need a combination approach of medications. Not going to go into all of those medications. Combination approach with medications and treatment. Movement getting off most of the tartar and to reassess you. And then if you have pockets that have not resolved, stay safe. And get back there and clean if those need to be taken out as well. People, they have localized we need a combination approach of medications. Not going to go into all of those medications. Combination approach with medications and movement getting off most of the tartar and to reassess you. And then if you have pockets that have not resolved, stay safe. And get back there and clean if those need to be taken out as well. People, they have localized we need a combination approach of medications. Not going to go into all of those medications. Combination approach with medications and then if you have pockets that have not resolved, stay safe. And get back there and clean if those need to be taken out as well. People, they have And then if you have particularly using spaces, and then if you have particularly using